Thank you, the Chair. Thanks, gentlelady. Recognizes Mr. O'Brien for 5 minutes.
Mr. Chairman, Member Pallone and members of the subcommittee, thank you for this opportunity to present testimony on this important question of conscience rights and access to comprehensive health care. For nearly 40 years, Catholics for Choice has served as a voice for Catholics who believe that Catholic teaching means that every individual must follow his or her own conscience and respect the rights of others to do the same. This hearing, to answer the question, do new health law mandates threaten conscience rights and access to care, I firmly believe the requirements under the Affordable Care Act and the slate of regulations being created to implement it infringe on no one's conscience, demand no one change his or her religious beliefs, discriminate against no man or woman, put no additional economic burden on the poor, interfere with no one's medical decisions, compromise no one's health. That is, if you consider the law without refusal clauses. When the question is asked in light of these unbalanced and ever-expanding clauses, the answer becomes yes, it would do all those things. When burdened by such refusal clauses, the new health law absolutely threatens the conscience rights of every patient seeking care for these restricted services and of every provider who wishes to provide comprehensive health care to patients. These restrictions go far beyond their intent of protecting conscience rights for all by eliminating access to essential health care for many, if not most patients, especially in the area of reproductive health services. This will make it harder for many working Americans to get the health care they need at a cost that they can afford. Like many Catholics, I accept that conscience has a role to play in providing health care services, but recent moves to expand conscience protections beyond the simple right for individual health care providers to refuse to provide services to which they personally object to go too far. It is incredible to suggest that a hospital or an insurance plan has a conscience. Granting institutions or entities like these legal protection for the rights of conscience that properly belong to individuals is an affront to our ideals of conscience and religious freedom. Respect for individual conscience is at the core of Catholic teaching. Catholicism also requires deference to the conscience of others in making one's own decisions. Our faith compels us to listen to our consciences in matters of moral decision-making and to respect the rights of others to do the same. Our intellectual tradition emphasizes that conscience can be guided, but not forced in any direction. This deference for the primacy of conscience extends to all men and women and their personal decisions about moral issues. Today, the 98% of sexually active Catholic women in the United States who have used a form of contraception banned by the Vatican have exercised their religious freedom and followed their consciences in making the decision to use contraception. Thus, they are in line with the totality of Catholic teaching, if not with the views of the hierarchy. Having failed to convince Catholics in the pews, the United States Conference of Catholic Bishops and other conservative Catholic organizations are now attempting to impose their personal beliefs on all people by seeking special protection for their conscience rights. They claim to represent all Catholics, when in truth theirs is a minority view. The majority of Catholics support equal access to contraceptive services and oppose policies that impede upon that access. Two-thirds of Catholics, 65%, believe that clinics and hospitals that take taxpayer money should not be allowed to refuse to provide procedures or medications based on religious belief. A similar number, 63%, also believes that all health insurance, whether private or government-run, should cover contraception. Sweeping refusal clauses and exemptions allow a few to dictate what services many others may access. They disrespect the individual capacities of women to act upon their individual conscience-based decision. They impede the rights of women and men to make their own decisions about what's best for them, their health and their families. Lawmakers of all political hues can come together to support a balanced approach to individual conscience rights and access to comprehensive health care. It makes sense for all those who want to provide more options to women seeking to decide when and whether to have a child. It makes sense for those who want to keep the government's involvement in health care to a minimum. Above all, it makes sense for a society that believes in freedom of religion, a right one can't claim for oneself without extending it to one's neighbour. The bottom line is that protecting conscience rights and preserving access to care shouldn't just be about protecting those who seek to dictate what care is and is not available, nor should it be for those who would dismiss the conscience of others by imposing their view of which consciences are worth protecting. Protecting individual conscience and ensuring access to affordable, quality care is not just an ideal. It's a basic tenet of our society, and it's the right thing to do. I thank the subcommittee for inviting me today.
Chair thanks the gentleman and recognizes Mr.